Why is your dog coughing like he's choking? Understanding tracheal collapse and the latest holistic remedies introduction. When a cough isn't just a cough. Hearing your dog cough like he's choking can be both alarming and heartbreaking. It sounds like a goose honk or a harsh hack, often mistaken for kennel cough or even choking on food. But for many small breed dogs and even some large ones, this may signal a progressive degenerative condition known as tracheal collapse. As pet owners seek gentler, more natural methods to care for their furry companions, holistic remedies and modern insights have become a critical part of the conversation. In this comprehensive report, we delve into the causes behind this peculiar cough, uncover what tracheal collapse really is, explore how it's diagnosed, and present the latest non-invasive holistic solutions that go beyond conventional medicine. Section 1. What is tracheal collapse? The trachea, or windpipe, is a tube made up of C-shaped cartilage rings and connective tissue, allowing air to pass from the nose and mouth into the lungs. In healthy dogs, the trachea remains open and stable. However, in dogs with tracheal collapse, this structure becomes weakened. The cartilage rings begin to lose their rigidity, flattening over time, causing the trachea to collapse inward. Symptoms of tracheal collapse. Chronic, dry cough sounds like a honk. Coughing when excited or after exercise. Difficulty breathing. Gagging or retching. Cyanosis, bluish tongue and gums. Intolerance to heat or exercise. Breeds most at risk. Yorkshire Terriers. Pomeranians. Chihuahuas. Toy Poodles. Lhasa While most common in small breeds, tracheal collapse can also affect larger dogs, especially those with obesity or chronic respiratory conditions. Section 2. What causes the trachea to collapse? The exact cause of tracheal collapse is not always clear. However, there are both congenital and acquired factors at play. Congenital weakness. Many small dogs are born with tracheal cartilage that is softer than normal. Obesity. Excess weight puts pressure on the respiratory system. Environmental factors. Exposure to smoke, dust, or chemical irritants. Chronic inflammation. Conditions like bronchitis or allergies can contribute. Neck trauma. Use of traditional collars can aggravate the trachea. Section 3. How is tracheal collapse diagnosed? Veterinarians typically use a combination of clinical signs and diagnostic tools. Physical exam. Listening for the telltale cough. X-rays. To detect narrowing of the trachea. Fluoroscopy. Real-time imaging to observe the trachea during breathing. Endoscopy. Direct visualization using a small camera. Blood tests. To rule out infections or other systemic issues. A proper diagnosis is crucial before moving on to treatment, especially holistic options. Section 4. Conventional treatments versus holistic approaches. Traditional treatments may include cough suppressants, bronchodilators, steroids to reduce inflammation, antibiotics, if secondary infection is present, surgery in severe cases, tracheal stents. However, these treatments often come with side effects, such as increased thirst, immune suppression, and long-term dependency. Holistic approaches offer alternative and often gentler interventions. Herbal medicine, acupuncture, nutritional therapy, homeopathy, lifestyle modifications. Let's explore these holistic options in detail. Section 5. Nutritional therapy for tracheal health. A well-balanced anti-inflammatory diet can support overall respiratory health. Key principles include weight management. Excess weight is a major risk factor. Caloric control and portion management are essential. Anti-inflammatory foods. Incorporate omega-3 rich fish oils, turmeric, blueberries, and green leafy vegetables. Avoid food triggers. Some commercial dog foods contain allergens or additives that can worsen coughing. Homemade diet tips. Lean proteins, chicken, turkey, fish. Steamed vegetables, carrots, spinach, pumpkin. Bone broth, great for hydration and nutrients. Supplements that may help. glucosamine and chondroitin, may support tracheal cartilage. Omega-3 fatty acids, reduce inflammation. Vitamin C, supports collagen production. 2. Marshmallow root, contains mucilage that coats the throat, reduces irritation. 3. Mullein, expectorant and anti-inflammatory, traditionally used for bronchitis and coughs. 4. Slippery elm bark, like marshmallow root, it forms a soothing gel, helpful for gagging and dry coughs. Important: always consult a holistic veterinarian before starting herbal treatments. Section 7. Acupuncture and chiropractic care. Increasingly, pet parents are turning to Eastern medicine practices. Acupuncture helps stimulate nerve pathways and improve respiratory function, reduces inflammation and pain. Chiropractic adjustments, gentle manipulation of the spine may relieve nerve compression, helps improve posture and ease pressure on the trachea. These techniques require a certified practitioner experienced in animal care. Section 8. Homeopathy and essential oils. Homeopathy. Remedies like Spongia tosta or Drosera are often used for dry, honking coughs. Must be matched carefully to the dog's symptoms by a trained homeopath. Essential oils. Lavender or eucalyptus, in diffused form only, can support breathing. Never apply oils directly to a dog's skin or allow ingestion without guidance. Note: dogs have extremely sensitive noses. Always introduce essential oils cautiously. Section 9. Lifestyle adjustments to protect the trachea. Switch from collar to harness. A no-pull harness reduces pressure on the neck. Reduce exposure to irritants. No smoking indoors. Use air purifiers. Avoid strong cleaning products. Humidifiers. Moist air soothes dry airways. Controlled exercise. Short walks instead of strenuous play. Avoid excitement and overheating. Section 10. Prevention and long-term management. While there is no definitive cure for tracheal collapse, dogs can live long, happy lives with proper management. Tips: annual vet checkups. Monitor for worsening symptoms. Maintain ideal weight. Choose non-invasive therapies. For pet parents, understanding the nuances of this condition empowers you to make proactive decisions that honor your dog's quality of life. Final thoughts. Hope beyond the cough. Hearing your dog cough like he's choking is never easy, but it doesn't have to spell despair. Through a combination of veterinary insight and holistic care, many dogs with tracheal collapse go on to enjoy years of comfort and companionship. As research evolves and pet wellness gains more attention, we now have access to updated, holistic remedies that offer safer, supportive care with fewer side effects. Stay informed, stay compassionate, and most of all, stay connected to your dog's needs, because behind every cough is a heart that trusts you to help.